Hi, I'm Nick. This is Sam. We're clinicians here at Complete Physical Therapy, and we want to review a common exercise we use here for core and hip and lower extremity strengthening. It's called the bridge. The first phase of this is what we call a brace of the core. One of the simplest ways I found to cue people is to imagine someone's going to poke you hard in the side, and you're just stiffening the muscles in your side. We want to make sure you don't hold your breath, so there should be a gentle exhale with the bracing of the core muscles. Once we have our core muscles engaged, then we want to start to think about squeezing our glute muscles and slowly progress a lift of the hips in the air. I focus on folks maybe starting small, especially if they have back pain. Once that is feeling better, we'll progress and we'll lift higher. It's not uncommon to really feel the fronts of the thighs being stretched when we do that. Sometimes we'll also struggle with hamstring cramping. We try to cue folks to lift the toes up to minimize hamstring cramping when we're doing that. As we get stronger with this, we can progress to a two-legged up bridge and one eccentric lowering bridge. This way we can isolate one side versus the other, trying to make sure that we have equal strength from one side to the other. Once we've seen that we've mastered the strength of that, we can actually go to a concentric lifting with a single leg and eccentric lowering, both of that side. One of the things that we want to be careful of is avoiding a curling or a rounding out of the low back. That's a different exercise used for mobility. In this case, we're working on stability and strength. So she's bracing, keeping her spine neutral, and trying to focus on movement around the hip joint. And this is one of our favorite core and lower extremity strengthening exercises.